Welcome to the webinar on the Child and Family Services Review and the Program Improvement Plan. I can see that there are people still joining us, and we're going to go ahead and get started on time. We have a lot to cover this afternoon. As we've said in the chat pod, please make sure you have downloaded the files from the file share pod, as we will be referencing them during this webinar. So this webinar was developed through funding from the North Carolina Division of Social Services and in partnership with the Family and Children's Resource Program. We are part of the Jordan Institute for Families at the UNC Chapel Hill School of Social Work. One thing we want you to know is that the audience today is primarily made up of staff from local county departments of social services and division staff, but we are recording this, and the intention is that we would hope it to be shared with other stakeholders across the child serving system. So you'll be able to have access to that recording. So we do have a lot to cover today. The goals for this particular webinar, we hope that by the end of it, you will understand the Child and Family Services Review and the Program Improvement Plan process. We also want to make sure that you understand the components of the PIP and how they're going to help North Carolina achieve better outcomes for children and families. We want you to know what you can do starting today that can help correct some of the identified concerns in the CFSR. And we want you to understand the relationship between the PIP, the Program Improvement Plan, and the Child and Family Services Plan, the CFSP, and the Annual Progress and Services Report, which is the APSR. So what we're going to cover in our 90 minutes, we'll do a brief orientation to the webinar space and introduce our presenters. We'll give you a little bit of background and context for the CFSR, the results of the CFSR, and some context for how the PIP came to be. We'll talk about the process for developing the PIP, and then we're going to spend a chunk of time just talking about the actual goals and strategies and activities that are on the PIP. You'll see that in the file share pod that is still a draft that you are downloading, but we want you to have it in front of you so that you can reference the specific wording of the activities at this point. Then we're going to spend some time really digging into what does it mean for you and your agency and what you can do starting today to help. And then we are hopefully going to have some time for questions and answers. So we have a lot of people joining us today. We have over 500 people registered. We currently have almost 200 on the line, at least logged in. There may be more of you in each room. So the main way you're going to be able to communicate with us, and many of you are doing that already, is through the chat pod. So we want to make sure that you can access, if you have questions or comments, that you can put them into the chat pod. You can type directly to the host or the presenters, or you can just leave it into the main chat pod where everyone will see it. You will notice that when we have this many participants in the room, it moves very, very quickly. One of the reasons we record this so we can come back and track what all the questions were, and so that we can follow up at a later date. So on the topic of questions, we want to talk a little bit about how we're going to be handling those today, because it can be a challenge with this many participants to get to all the questions that you have. So what we're going to ask is that if you can hold your questions as much as possible until the end. We're hoping we're going to answer a lot of them through the content that we're covering. If something is said that you don't understand or you're not clear on, please feel free to type that into the chat pod so we can make sure that you're clear and you understand the content. And then we will try, if there's time at the end, to collect some of the themes John is going to be tracking questions and letting us know what are some of the repeated questions, and we will try to get some of those answered before our time is up today. There will be a follow-up document that will cover the questions, so we'll cluster them all into groups and we'll answer the questions for you. So if we do not answer your question today verbally, you will have an opportunity to get that question answered in writing. As we said, this is being recorded and it will be available on the Family and Children's Resource Program webpage, and you see that right there down at the bottom, and we can also email that link out as well. The other way you can get our attention is through using the icons. So you can click on, there's an icon of what looks to be a little person waving. If you click on the arrow next to that person, you'll see some options that you have, raising hand, disagreeing, agreeing, speeding up, slowing down, speaking louder. That will let us know how we can help you. And also at any time, if you're having technical difficulties, you can type questions into the chat pod, and we've got some people on the line that can be helpful to you. All right, so first we're going to, before we introduce ourselves, we are going to figure out who we have in the room. So we're going to go to the polling question. Okay. Uh-oh. Hold on one sec. Okay, so the poll question is, we want to know who is here today. And we know that many of you are participating in groups. So do the best that you can to represent the majority of people in your room when you select your answer. We just want to get a sense of who's in the room with us and the role that you predominantly play. We know many of you play multiple roles in your agency. So I'll give you a minute to do that. All right, so it looks like most of you have had a chance to answer the poll question, and it's good to see we've got a wide variety of folks in the room, and we have a majority of supervisors and social workers are really representing our group, so we're glad you're here, and hopefully you'll be key players, all of you will be, in implementing the PIP, so it's good to hear it directly and be able to share that information with others. All right, so we're going to go back to our slides. We did have a question about whether or not you can talk. There will be no ability for you to communicate with us verbally. So there's a question about whether or not you are muted automatically. You are not muted because you do not have a microphone, so you don't need to worry about, we will not hear you talking if you're in a group in the background. All right, so let me go ahead and introduce myself. I'm Laura Phipps, and I am going to be the moderator for today, and I work at UNC at the Jordan Institute at the School of Social Work, and I'm going to let our panelists introduce themselves and talk a little bit about their role, and I'm going to start with Kevin.
Good afternoon, everybody. My name is Kevin Kelley. I have the privilege to serve as the Section Chief for Child Welfare at the State Division of Social Services. Thank you for participating today.
Good afternoon. My name is Kristin O'Connor, and I serve as the Assistant Section Chief at the Division of Social Services for Child Welfare. Good to have all of you on the line.
And hello, I'm Shelia Stokes with Guilford County Department of Social Services, and I'm glad to have each and every one of you on the line to learn more.
Great, and we are happy to have all of you here. Also, we have on the line John McMahon and Philip Armfeld, who are here to support us with our technology. John is going to be tracking questions and hopefully showing us some themes that we can answer. And Philip is here if you're having any technical issues that you need to be addressed. Please feel free to chat into the pod what's going on and how we can help you. All right, so I am going to pass it off to Kevin, who's going to get us started with giving us some background and overview about how we got to where we are now.
Thanks, Laura. The one thing I want to make sure everyone understands is that the Child and Family Services Review is a federally defined process. It is not intended to encompass all of the program areas and services and improvements that we know we need to make in child welfare. It is within that context that the CFSR falls within. A little bit of the federal big picture from that perspective. I want to make sure everyone has an understanding of those requirements. The first is that 5-year strategic plan known as the Child and Family Services Plan. So the acronym is slightly different with CFSP. It is a document that all states and jurisdictions are required to submit that tries to address certain key areas. They align closely with federal funding, as you might imagine, so there's not a lot of content, for example, up on the front end of Child Protective Services assessments. That document is available on our website, and just so you know, we have completed the first year of that 5-year strategic plan. And each year during that 5-year strategic plan, states are required to provide a update known as the Annual Progresses and Services Report, or APSR. We are in the process of finalizing our APSR for the past year. It is due to our federal partners at the end of this month, so that will also be uploaded to our website at that same page that you see there as soon as we have finalization of that document. Those two are a much bigger picture than the CFSR and the Program Improvement Plan that we're here to talk about today, but even they do not encompass everything under that child welfare umbrella. And I think, as an example, that's one of the reasons the North Carolina General Assembly required and funded the CPS evaluation report that was conducted this past state fiscal year. And that's another document that really helps illuminate what is happening in child welfare in our state and what are some areas that we need to pay attention to. So as you can imagine, getting your arms around all of this at one time is a challenge in and of itself. So this document, if you don't see something that we talk about today, don't think that it's not being paid attention to or it's not part of our radar. It's just not within the scope of the federally defined CFSR and Program Improvement Plan. So just a little bit more on the CFSR. It is a very collaborative effort between the federal and state governments. I'm going to try and highlight a couple of those collaboration efforts and how we work together. It is obviously a federally defined process, and actually it's codified into the Code of Federal Regulations that the National Congress actually passes. It is aimed at promoting continuous quality improvement. It is aimed at identifying areas needing improvement across the state. And then you can imagine one system for evaluating all 53 federal jurisdictions then is a challenge in of itself, because we do vary greatly in size, scope, and design of our services. We often talk in North Carolina that we're one of about 12 states that are county administered. I will note that most of the larger states are county administered. So it's often pointed out to me that while a minority of states are county administered, if you look at children who are served, it's about equal distribution across the state between county and state administered. That's just one characteristic that I wanted to point out. A little bit of background, if you didn't already know, this is the third time North Carolina's experienced the Child and Family Services Review. The first one occurred in 2001, then a subsequent one in 2007. So there's obviously some significant time period between the two. And I will say that the Children's Bureau has made several changes, particularly between the second and third round, and that was one of the reasons there was a significant period of time between those two rounds. And those changes were in response to states and other partners' feedback to the Children's Bureau as to how the system could be improved to more accurately capture and effectively measure this large thing we call child welfare. So the structure of the CFSR is broken down into 7 outcome areas and 7 systemic factors. And we're going to go through these in as much detail as the time allows. What I want to share with you is that the Children's Bureau places much greater emphasis on the 7 outcome areas. That's probably why you hear folks talk about safety, permanency, and well-being fairly often. And it is the outcome areas measure, at least from the Children's Bureau's perspective, what is actually happening in children and families' lives who have been served by the child welfare system. And the primary measure by which those outcomes are measured is a case review tool known as the On-Site Review Instrument. And in 2015, North Carolina opted for a new federal option that states could conduct their own case reviews. If you were part of the previous ones, the federal government conducted the reviews. They limited that to 65 cases. That's not true just in North Carolina, but in all states. And one of the concerns we and many other states expressed was that that was a very small sample size. So in response to that, North Carolina enacted the option. We were very grateful and partnered with 10 counties to conduct the case reviews, and that enabled us to get the sample size up somewhat more representative, still far from statistically significant. And then the other thing we all know, but I just want to make sure we say out loud, is that in no state has all of the outcomes and systemic factors been found in substantial conformity. And that's a key phrase I want everyone to understand. There is no pass-fail to this. The system is designed to find areas needing improvement. And unless we were all perfect, there wouldn't be any areas, so therefore we know there's going to be items either under the outcomes or the systemic factors that we know we need improvement. And I think you can get a quick look at that by looking at the CFSR quick reference document. It's a PDF file in your SharePod, and that gives you just a real quick overview of those 7 outcome areas and 7 systemic factors within the CFSR structure. In order to be in substantial conformity on the outcome areas, those case reviews for each item must have reached a 75% noted as being a strength. With a sample size of even 100, that means for any given case, because not all items apply to all cases, 1 or 2 cases who weren't rated as a strength would mean that item then under that would not be found as within substantial conformity and therefore an area needing improvement. The federal government is very clear to point out that the bar is set intentionally very, very high. It is not meant to be like we were used to something on a grading scale. They are looking for something very close to perfection, and that's what we want for our children and families. And then also within the outcomes for 2 of the 7 outcome areas, there are associated data indicators, and those come from what we here in North Carolina refer to as the Central Registry and the Child Placement and Payment System. They are processed through federal files known as NCANs and AFGARs. I won't go into a lot of those details. And as you probably have known from the final report, the Children's Bureau has determined our data to be of insufficient quality to generate those data indicators. But you'll hear us talk here in a little bit about what we're doing to address that very issue so that we can also meet the data indicators for Safety 1 and Permanency 1. So I'm going to turn it over to Kristin, who's going to walk through the outcomes and systemic factors.
Great, thank you, Kevin. And Kevin mentioned just a bit ago about the quick reference items list, and this really becomes a nice resource for the next several slides that I'm going to go over. I mean, really nice summary to kind of get our heads around the wealth of information that is covered in the CFSR process. So I'm going to start off with the seven child and family welfare outcomes that are measured. And the purpose here is really to provide you with a nice high-level overview of these areas, knowing that that quick reference items list is going to allow you to go into much greater detail if you have specific questions about any one of them. But the first is safety outcome number 1, which really is looking at measures of timeliness to responding to reports of child maltreatment. Along with safety 1, as Kevin mentioned, we do have data indicators associated with this particular safety outcome, which include findings of maltreatment of children who are served by foster care and children who are repeat victims of maltreatment. So this safety 1 really obviously is the crux of what we do to make sure that children are first and foremost protected from abuse and neglect. Moving on to safety outcome number 2, what this one is really trying to assess and measure are the efforts to protect children while they're still in their homes and to prevent removal or re-entry into care, as well as an assessment of risk and overall safety management of those children, those families in those cases. Permanency 1 measures both the efforts to achieve permanency for children served by foster care and the services to ensure that children don't require movement in their placement settings. Permanency 1 has quite a few data indicators. There are 5 total. 3 are measurements of how quickly children achieve permanency. There's 1 measure that is around the rate of reentry into foster care, and we also have 1 measure around how frequently children are moving while they are served by the foster care program. Permanency 2 really is looking at the services and the measures of the services to ensure that children served by foster care remain connected to their parents, to their siblings and other family members. Here we're assessed as to the degree to which placement with siblings, visitation with parents and siblings, relative placements, and relationships of the child with his or her parents is demonstrated. Moving on to our 3 well-being outcomes. Well-being number 1 measures the ability to identify the needs and provide appropriate services to address those needs. This is a pretty broad area, and in many ways really the core almost of, not necessarily the core in that it's not the most important piece. We know that safety first and foremost is important, but when we do have children safe, we now know that once that's accomplished, we ultimately want them to, and their families, to feel well. We want them to be well. We want them to do well. And these well-being outcomes are really aimed at accomplishing that. It not only includes the parents of origin, but really important to know that this includes our foster parents as well, ensuring that their needs are identified, assessed, and met in their role as resource parents. The involvement of the child and the family in case planning and the frequency and quality of caseworker visits are also assessed in Wellbeing 1. Wellbeing 2 is measuring the agency and the degree to which the agency is assessing the educational needs of children and addressing the needs in those case management activities regarding educational attainment and those needs. And then Child Wellbeing 3 is asking the question as to whether or not the agency addressed the physical health, including the dental needs, and their mental and behavioral health needs. This outcome area is also where we find appropriate oversight of prescription medications for children and youth served in the foster care program. With respect to this slide, what's probably the biggest takeaway here, as Kevin mentioned, we are in our 3rd round of the CFSR. And really the difference between round 2 and round 3 is that in round 3, being that we have opted for the state-led review process, that has resulted in far more cases being reviewed and far more counties participating in that review process. And you can see here that for round 3, we've had a total of 105 cases, equaling 59 foster care and 46 in-home cases. That review is conducted between the time frame of April 1, 2015 to September 30. Also of note is that cases involving the children belonging to the Eastern Band of Cherokee Indians were required to be sampled. We had a requirement from our federal partners to include those children, and so the counties Haywood, Jackson, and Swain initially also were identified, and we were required to sample cases of children belonging to the EBCI. And while Haywood was actually included in that sample, there was no case pull of any child from Haywood County. And you may be aware, hopefully you are aware, that the EBCI has now have approval and they're operating their own child welfare agency, their own Title 4E and 4B agency, and so therefore we will not be required to pull a sample of EBCI children moving forward for review. And later on in our webinar, Kevin will be talking more at length about our measurement plan and what that's going to look like for us moving forward. Moving on to our 7 systemic factors. Systemic factors really are the supportive components that we know that when they're present and operating effectively, we believe contribute to a positive delivery of programs and services within our system. And it's really difficult to have a standard of measurement for functionality here. Those systemic factor decisions were based on data and information that was included in a statewide self-assessment that we had to produce, as well as stakeholder interviews that were conducted. North Carolina was required to have 31 different interview sessions because information coming out of our statewide assessment did not provide ample information for the federal government to really assess our functioning. So those structured interviews did take place, and overall we were pretty challenged to provide data on each of these 7 systemic factors. Really quickly, those include our statewide information system, and while we're not diving into the findings yet, this is really where our lack of a statewide case management system impacted our achievement in this area. Our case review system is predominantly a court-related systemic factor with items that are related to the degree to which written case plans are in place, periodic reviews, permanency hearings, TPR proceedings, and notification of reviews and hearings provided. And the quality assurance system is really looking at the degree to which we have standards to evaluate the quality of our services, the ability to identify strengths and needs of our service delivery system, the ability to produce relevant reports, and then to evaluate the implemented program improvement measures. Moving on to the next slide, our staff and provider training systemic factor really is looking at a couple of different things. One is initial and ongoing training of all staff that deliver services. And it also, though, is looking to ensure that training is occurring statewide for current or prospective foster parents, adoptive parents, and the staff of our licensed supervising agencies. So this is a fairly large systemic factor that takes a look at our entire training system. Our service array next and resource development is taking a look at the identification of needs of children and families and ensuring that we address those needs on an individual basis. It includes the needs of our children and families receiving both in-home services and services to help foster and adoptive placements achieve permanency. The next one around agency responsiveness to the community. This factor really is basically measuring how well we are collaborating, getting input, identifying concerns across our system and across our partners and sister agencies at the local and the state, and in some cases our federal levels. We will be doing more regarding our efforts, as you'll see as we move through this webinar. And then our foster and adoptive parent licensing, recruitment, and retention systemic factors. You can see here there are 4 primary areas that are assessed. We are really taking a look here to the degree to which we're functioning statewide to ensure that state standards are applied to all licensed foster family homes or child caring institutions that are receiving Title 4B or 4E funds. It should be noted that this was noted as a strength in our final CFSR report, which is fabulous. It really talks to the adherence to administrative rule, our monitoring protocols, our consultative support that we provide, and certainly the good work that's happening at the local level to ensure that those standards are applied consistently. That consistently came through as a strength in our stakeholder interviews as well as in our statewide self-assessment. The background checks are asking several questions. Does the state comply with federal requirements for criminal background clearances? And is there a place in case planning that includes provisions for addressing the safety of foster care and adoptive placements for children? This one certainly was not rated as a strength, that there were several inconsistencies that were noted in our ability to adhere to this particular systemic factor, which we'll be talking about when we go into the findings. Diligent recruitment that occurs is really asking some questions around, is our system functioning to ensure that the recruitment of our potential foster and adoptive families are reflecting the racial and ethnic diversity of children? Is that happening statewide? Do we have a uniform system in place that monitors consistent standards for diligent recruitment? And we don't. We have disconnected diligent recruitment efforts. So you will see in our program improvement plan some efforts at trying to strengthen our statewide diligent recruitment activities as well. And then the final systemic, I move here, this isn't, the final area in our systemic is cross-jurisdictional. I apologize. So cross-jurisdictional resources, are they used to facilitate permanence? While we did provide information about our state ICPC, our Interstate Compact for the Placement of Children process, this item really is taking a look at the degree to which we can assess the data that shows that cross-jurisdictional resources, and that being interstate as well as inter-county within our state, are those resources being utilized to help achieve permanence for children? And the timeliness of the state's ICPC process and the county's use of inter-county resources were noted as concerns in our final report. Okay, so now I'm going to turn this back over to Kevin, who's going to take us through the results of the CFSR.
Thanks, Kristin. I'm sure by now everyone understands that the program improvement plan will need to address all 7 outcomes and 7 systemic factors. One of the conditions, I believe, that led to particularly the systemic factors was that historically North Carolina had not echoed the federal language that we've given you a little bit about so far, namely the Child and Family Services Plan and the annual Progress and Services Report update to that plan. So one of the activities that we're already undertaking as a result of this webinar is to make sure everyone understands what those documents are. As you look at them and have a chance to go through them and identify what are those areas that we were asked to address and explain how North Carolina is performing on those areas, I'm pretty sure you're going to find very few, if any, surprises to that. Those are all going to be very, very familiar to you. But again, during the assessment of our systemic factors, the federal government had to ask the questions in a state-neutral way. So we just hadn't made that connection between the federal language and how we talk about them here in North Carolina. With respect to the outcomes, again, they are measured through the case review process, and we are going to talk a little bit about increasing our investment in using the on-site review instrument, making sure that we are paying attention to those items that the instrument measures, and that we increase our quality assurance efforts through the use of the on-site review instrument. I'll note that the program improvement period is a 2-year period, and that again is federally defined. It does include a 3rd year where we can measure our performance, and that measurement is again the execution of the on-site review instrument. So as I mentioned at the beginning, the PIP is rather narrowly focused on those items that were addressed in the CFSR. It isn't the totality of what we want to address in the child welfare improvement, or I should say the child welfare system of services and programs. It is a great opportunity to better align our resources, to clarify for everyone what we mean when we talk about child welfare. I think the systemic factor of agency, responsiveness, community really plays into that concept. It is broken down and structured, and if you were in North Carolina following the 2nd round, our program improvement plan had very little structure to it compared to what it has now. Again, the draft that you have today, will change in the future. We don't think dramatically, but we'll have some minors. But you'll see that that structure is composed of 5 goals. Each goal has multiple strategies under it, and then those strategies are broken into very concrete activities. And we believe by executing all those, we will improve the services and ultimately our outcomes for children and families. I just want to keep saying the PIP is not the mechanism to address all of the needs in North Carolina. There will be many others. You are familiar with the term practice model or practice framework. You will not see that mentioned in the program improvement plan. And again, that does not mean that we are taking that off the table permanently. It just could not be accomplished within the framework that the program improvement plan structures. Also, please note that the program improvement plan is not specific to those 10 OSRI counties or counties that helped us measure our outcomes to begin with. It is applicable to all of North Carolina, all 100 counties. And that's why we want to make sure we begin to disseminate that information just as quickly as we possibly can. A little bit of background. The review itself occurred in 2015, and the final report, as you see on the website, is stamped December of 2015. That's because that's when the federal government finalized all those activities. We did not receive our actual report until February 2nd of this year. But we began the activities immediately anyway, and I think Kristin's going to walk through how we are approaching the development of our program improvement plan.
Great, thanks, Kevin. So as Kevin mentioned just a bit ago, the PIP program improvement plan is going to be implemented over a 2-year period, with that third year being for measurement. And as mentioned, we had the final report finally given to us in February, but we actually did have the opportunity to see some of the draft findings prior to that finalization of the report, which did allow us to begin working on the hard work of identifying some themes, cross-cutting themes in that report, and what we wanted to do to address them for the program improvement development process. So as you can see here, in January 11th and 12th, which I'm sure many of you participated, as we had more than 270 stakeholders convene to come together to take a look at that report. At this point, it was still an initial report, and it was really only presented in a PDF, actually, a webinar. Our federal partners from the Children's Bureau were on site that day, over those 2 days, actually, to help us walk through those findings and to help us identify some of the cross-cutting themes with us. And during that 2-day session, we discussed expectations for ongoing involvement of the partners and the stakeholders in the development of the PIP, understanding at that time it was also very new to us as well, trying to wrap our minds around just the level of detail and the amount of information coming to us in that final report, or in that draft final report. We also began to brainstorm about how to dig deeper into the data to understand some of the root causes of underperformance. One of the processes that we were definitely encouraged and expected, I should say, to follow, and ones that we subscribe to or trying to work towards within our own system, is looking through a continuous quality improvement lens for how to address problem areas. So before just jumping into strategies and thinking about how we're going to solve issues, let's take a real good look at the data and try to dig deeper into understanding what's causing a particular system functioning issue, and how can we address it in a much more intentional way. So 5 themes were identified after taking a look at all of the information that came through, and then we convened work groups again in March of 2016. And in March, we held day-long workshops for each of the 5 themes that you can see here on your slide that centered around court collaboration, county practice, the system infrastructure, stakeholder engagement, and service collaboration. And what we really led the groups through was a process by which they would help us identify issues within that theme that contributed to outcomes or the systemic factors. We also had asked participants to help us develop some initial goals and strategies or interventions to address those focus areas, and then to outline some activities or metrics for those strategies that were identified. As Kevin mentioned already, that this is really a collaborative, has been a very collaborative, iterative, negotiated process between the state and the Children's Bureau. And what came out of the group in the days in January as well as in March, some of that initial information, may look different than what you're going to see here in terms of some of our PIP goals and strategies, because since that time, and even for months leading up to those stakeholder groups, we have been meeting weekly with our federal partners to review not only getting ready for the CFSR, but for the last many, many months, taking a look at developing the program improvement plan, getting feedback from the federal partners, and responding to what they expect to see in that document. We also did conduct a survey in May of 2016 to get some of your feedback from, and as well as some external stakeholders regarding the draft plan. And that was really, really helpful for us to make sure that we can check some of our assumptions and check some of the work as you're in it so often and you're working so closely with the same information week after week. It's very, very helpful to obviously get the input from the counties, because we cannot do this work without you. And so I'm going to turn it back over to Kevin at this point, who's going to review with you the themes of that survey that was initiated in May.
Thank you, Kristin. I just want to make sure everyone understands your input has been heard. I guess the reason I wanted to keep saying that is because as we work through that negotiating process with our federal partners, they're very careful for us to make sure that the program improvement plan is achievable, which in some ways may sound contrary to the very first bullet there. It is still a very ambitious plan, and we understand that, and that's one of the reasons I will say that the program improvement plan is not yet complete. That goes hand in hand with that third bullet, that we do understand we have limited capacity to provide technical assistance support, such as training to county departments of social services. And I'm going to talk a little bit about, and you already know, that the General Assembly is working to finalize a budget that will hopefully provide us with additional resources to support counties. I know there's confusion over our technical assistance, quality assurance, we call it program monitoring, how they align, interface overlap. We initially had that in our program improvement plan, and from the feedback we received from our federal partners, you will no longer see that in the plan. Again, do not think that that means we're not going to pay attention to that. That is a predominant theme we hear on a very regular basis. It is something that we're going to do outside of the program improvement plan, but we are still going to do that. We know how important that is. The Children's Bureau invests heavily in that on-site review instrument, and that's where they center their definition of quality assurance. They recognize that we have a broader definition and that we will continue to do that, and they encourage us to do that, but rather than tie it to the constraints of the program improvement plan, that's just another one of those examples that it's not in the plan specified, but it is something we will be paying attention to. And then we also completely understand the reality of the frontline workforce. Caseloads are escalating. We appreciate your ability to complete the workforce data books for us so that we can message that to key individuals so that they understand in order to do the work we have to have the resources, aka staff, in order to do that, and paying attention to issues to help reduce staff turnover, because that is, we understand that is another significant problem in able to meet the demands of child welfare services. I talked a little bit about our request to the General Assembly. It's in excess of $9 million. Right now it's marked as non-recurring. We need that to become recurring, and our Secretary, Rick Brazier, is messaging that as strongly and as clearly as we possibly can. We believe we're being heard, and anxious to see them switch that to recurring funds. We're also using the program improvement plan to streamline some of our own internal processes and procedures so that we don't have those confusion and be more efficient with what we do have. And then I will say there's real good energy working across the various divisions within DHHS, but also the Department of Public Instruction and the Department of Public Safety, who also serve children in various ways, to make sure we're all working together for the same goal. And that we're going to walk through the program improvement plan. You will see that we are really focused on clarifying policies so that it is more Still a difficult job, but it is slightly more attainable. We know we need strengthening training. You've heard us talk about the Supervisor Academy to make sure supervisors have the information they need to support their staff, and some of the other activities we're going to walk through here in a little bit. So I'm going to turn it back over through our goals, strategies, and activities.
Great, thanks, Kevin. So we have the draft program improvement plan, which you do have in your file share pod, so it would be helpful to go ahead and grab that document now as a reference, because it is a fairly heavy document that we aren't going to be able to get through all of the specific information in it, but you will begin to see over the next several slides just where to reference information and to understand some of the flow of this document and what we're thinking and proposing. So the document itself is broken down into 3 areas. You'll see 5 different goals, and then within each of those goals there are strategies which really are looking at the components that will have a positive impact on that goal area. The program improvement plan, as you can see, currently has 16 different strategies identified. And then within each strategy there are activities that are identified, which were more specific actions with timelines, and the timelines that we are referencing in the program improvement plan have begin and completion proposed dates around quarters. We felt that was much more realistic to really be looking at a quarter in terms of completion or begin and completion dates instead of actual dates, to allow us a little bit more flexibility for success. So moving on to goal number 1, this is really one of our biggest goal areas. Understandably, it's focusing on improving our safety, permanency, and well-being outcomes through the establishment of clear performance expectations for practice. And as you can see, the 5 different strategies that we are going to be proposing to implement, as Kevin also mentioned, revolves around policies and practices, training of our staff, the establishment that's already been ongoing for the last couple of years around a Supervisor Academy, and then really strengthening our TA model and our policies around technical assistance, and then looking at development of some parent modeling, which I'll talk about in just a second. But around this particular area, this one I think has had the most feedback, and it's had the most revisions to it, I think, of all 5 of our goals. There were some pretty significant concerns noted by our federal partners, as well as from the final results of the CFSR, around making sure that risk and safety were being assessed, that practice and cases were being closed appropriately and timely, that there was involvement of families in that case planning process. When we initially developed this program improvement plan around this goal, we did have in there work around implementing a child welfare practice framework, but then we were also, again, required to really get more narrow in the focus, and understanding that the implementation of the program improvement plan is only 2 years. Anything that we do in terms of a practice model or practice framework requires much more time beyond a 2-year implementation period. So the activities in this program improvement plan need to start and end within that 2-year period. So what we decided to propose within the policy and practice area in particular, the first strategy, was to take a look at our current policies and our current practices and review, refine, and clarify where needed. There is an assumption here that we want all of you to know, is that what we have in terms of our current philosophies, our family-centered practice, our principles of partnership, our MRS strategies are good. They're inherently good. And so what we want to make sure that we can do first before throwing everything out is taking a look at what areas of the CFSR were identified as areas needing improvement, and to take a look at the corresponding policies and to strengthen those to provide more clarity and more training around those particular policies moving forward as a first effort to improve outcomes in this area. We also are looking at the training of our staff. And so as you move through these strategies and you move through these goals, what you're really going to see is somewhat of an implementation flow. So all of the activities that are flowing from the strategies are meant to give the reader, who of course are multiple different types of people and different stakeholders, intended to give the reader a really good sense as to the flow of how this is going to work. So we wanted to capture, once we identify and review those policies and practices, what is it going to take to actually implement them and publish them, and then to get staff trained. The training aspect of what we're going to be working at certainly is anytime we revise policy, we want to ensure that our training mechanisms and our training curricula are revised accordingly. What we also want to begin doing is really focusing on tightening policy so that it is policy, and pulling out of policy those areas that are considered to be best practice or practice guidance, and to be developing accompanying practice manuals or practice framework guides for county use. So that we can make sure that when you pick up a policy, you can get the answer quickly to what you need, and we can train a little bit better in terms of best practice. Also, we have already started and well underway in the development of a Supervisor Academy, taking a look at the supervisor as really a primary change agent for improving outcomes for children and families, and ensuring that the frontline workers and staff have what they need to be successful in the delivery of their work. So you'll see strategies around implementing and finalizing that Supervisor Academy and getting that rolled out into our counties. Technical assistance, we've heard loud and clear from the counties, and this came through certainly in our statewide self-assessments as well as in our stakeholder interviews, that we need to strengthen the degree to which and the manner in which we're providing more consultative and technical assistance support to the counties in implementing policy and practice. So as we revise policies and establish best practices and establish those practice guides, then naturally we're also going to be engaging in activities to beef up our technical assistance and to strengthen that so that the county's needs are being met in a better way. And then the last activity in this particular strategy, or in this goal, the last strategy is around development of a parent model. So we, of course, have been thinking about this for a long time. We have lots of requirements to ensure that there's family engagement, not only in our case planning activities and the delivery of service, but really from a leadership perspective. So you're going to see that this particular strategy and the activities that follow is looking at development of a statewide parent advisory council and establishing a mechanism by which we can get family and parents established as leaders to have more of a family voice in the decisions that we're making and the policies that we're developing and the plans that we are writing for the state of North Carolina's child welfare system. Moving on into goal number 2. This one, as Kevin also touched upon, is really focused on improving our statewide quality assurance system. There are 2 strategies here around a quality assurance system and technical assistance model related to quality assurance. For purposes of the program improvement plan, as Kevin already noted, we are using and concentrating predominantly on what our federal partners have really required us to focus on in terms of quality assurance, and that is case review using the on-site review instrument. So what are the activities and the strategies that we want to employ over the next 2 years to ensure that we can strengthen the use, first the understanding and the awareness and the knowledge of the on-site review instrument, and then of course the use of the on-site review instrument to generate data that can then be used to help improve and inform strategies for improvement at the county level. We know that we are going to be providing quality assurance oversight to the staff in the initial 10 counties that were using the on-site review instrument for purposes of the CFSR. There will be 113 cases reviewed among those 10 counties using the on-site review instrument. But we also are going to be looking to certainly do random sampling in the other 90 counties and beginning strategies and activities to increase awareness and the understanding of how the use of an OSRI can help move our system forward. I'm going to move us forward here into Goal 3. Goal 3 has 3 different strategies, and there are 12 activities total identified here. And this one really is looking at how to strengthen our collaboration with our court partners. So 3.1 is focusing on the development of a plan to engage the local court and the local DSS to address issues of notice to resource parents, timely establishment of case goals, concurrent planning, permanency and timely TPR actions. And what we plan to do is to utilize findings from the CFSR as well as from court improvement measures to develop what we're calling a permanency performance profile, with the idea being that we want to publish that profile at the state, county, and judicial levels so as to spur some increased collaboration around improving data quality and permanency outcomes. There's a lot of conversation about what that permanency performance profile needed to include, and in feedback with our federal partners, we landed on the fact that that profile needs to include those items within the CFSR that were identified as areas needing improvement. Section or strategy 3.2 around court engagement is then going to be taking that information and providing activities to give more targeted engagement and technical assistance to the county departments of social services and court personnel in those districts where that data is indicating children aren't achieving permanency as outlined in that profile. And through that, we also want to develop some opportunities to engage in collaboration and to provide some customized training for social services staff and court personnel around what that permanency profile is indicating, again, with a focus on permanency outcomes. And then strategy 3.3, you're going to see, is really a strong focus on implementing another program that we have already started doing some work around, which is our guardianship assistance program. We have started this work, so we wanted to make sure to put into our program improvement plan opportunity to highlight that work that we're doing to support permanency and stability in children's living situations. So the important piece here is that GAP is going to utilize our current foster care budget to provide for this program. It needs to be cost neutral, with the idea of providing for guardianship assistance payments to licensed relative guardians. There are rules that are already going through the approval process for enactment. We do anticipate the guardianship assistance program being effective January 1st, 2017. I'm now going to turn this over to Kevin, who's going to take you through goal 4 and 5.
Thanks, Kristin. Our fourth goal really speaks to cross-system provision and how we can work with our partners. You'll also see goal or strategy 2 speaks of beefing up our foster adoptive parent recruitment. I probably don't need to echo what you already know, and that is the mental health system in North Carolina is a key partner in achieving the outcomes for our children and families. And as you look at that strategy, you'll see those activities spelled out, I think, in a way that will make a lot of sense. What we've heard from a number of counties is that we have hopefully surpassed the stage where we're talking about collaboration and ready to enter a stage where we're more specific as to what are the service expectations, both on the county DSS side, but also on the LME MCO side. I'm happy to report that we, again, have already begun this activity. We submitted it in conjunction with the Institute of Medicine a grant request to the Duke Endowment to help facilitate these kinds of gatherings where counties across a given LME MCO will come together and work through written agreements as to what the necessary service provisions regarding timely referrals for services and making sure that we're all working together from the same perspective and understanding what each side agency can and cannot do within a given expectation. The Duke Endowment has funded that, so next week we are having an next month we are beginning to kick that off and design that in such a way that meets all 100 counties. We have made a commitment from the DHHS side that we will have staff from 4 different divisions, not only the Division of Social Services, Medical Assistance and Mental Health, as you can imagine, but also the Division of Aging and Adult Services has made the commitment that we will have at least one staff member at each and every gathering at all 8 LME MCO catchment areas. We hope County Department of Social Services can make equal commitment to those meetings, to the extent possible have decision makers in those meetings, and as extent possible have consistency across those meetings so that we can move through and develop those written agreements as quickly as we possibly can. We've also begun to reach out to the National Resource Center for Diligent Recruitment with respect to Strategy 2 under Goal 4. We understand that not having foster parents available when children come into custody is a key barrier to effectively achieving outcomes. You cannot provide good quality services if you're driving halfway across the state to place children and then to meet their needs on a regular basis. So in fact, we had a call just before this webinar to begin that discussion. So we'll be working not only with each and every county, but also our private agencies to make sure that we are enacting the diligent recruitment plan as effectively and as efficiently as we can, and supporting those foster parents who have agreed to open up their hearts and homes to those children. And then the last strategy under Goal 4 is really aimed at what we talked about a little bit earlier, and that is to make sure we're effectively communicating the CFSP APSR goals and our status with respect to those. You'll see some of these activities also spell out how we can work and support currently licensed foster parents in developing what we're referring to as a resource parent portal. One of the lessons learned from the stakeholder interviews that the Children's Bureau did last year was that we had a very difficult time at the state level reaching licensed foster parents. And I think it's easy to see in a North Carolina system where there is an intermediary agency we refer to as supervising agencies. That's both public and private. And then also continuing the good work with others to understand, such as SAYSO and others, that what North Carolina needs in terms of a child welfare system, and how, again, echoing the federal language to make sure we are all on the same page. The fifth and final goal may not make a lot of sense to a lot of folks, and I'm going to do the best I can. I talked a little bit earlier about the data that we are required to transmit to the federal government on children who are served by the foster care system and children who achieve permanency through adoption. And that is the file set known as AFCARS, or the Adoption and Foster Care Automated Reporting System. That's where our data begins to have the quality issue that we talked about. It's no surprise to anyone in the county that knows that we do not have the system set up where a SIS number can transpose across county lines. The federal government knows that, and they are monitoring our data and have noted that while we report a very low reentry rate, they are suspect of that reentry rate because, again, a child who is entered care in a different county than the previous spell may not be seen as the same child. The good news is we are able to resubmit those AFCARS files after we identify duplicate SIS identification numbers prior to transposing those to AFCARS IDs. Other states do that on a routine basis, and that we will be working through that effort and hopefully being able to achieve the data quality that the Children's Bureau requires. The second strategy, I think everyone has been deeply involved in the early development of what we refer to as Project 4, the Child Welfare Module. The JAD sessions are kicking off now, so I want to thank all the counties who have staff who are making sure that we develop that system in accordance with our needs, and that it's implemented effectively once we get to that stage. The Children's Bureau initially did not want us to specifically tie in the NCFAS system into this. So you'll see some of those, the activities under this strategy do not drill down all the way to implementation of Project 4 for child welfare. And that's because, again, the PIP structure is such that it's a 2-year time period. We hope that we can implement NCFAS in that time period, but as the business plan spells out, we will not implement NCFAS until it is developed in accordance with to meet the county needs. And then the very last strategy under this last goal is a system that is still being developed to provide key information to county departments of services, particularly related to safety. So this is a web-based data warehouse that will eventually include criminal record information, so that when, for example, an assessment is begun, you will be able to go to one web portal and collect array of information from various sources, but in a single interface that's easy to use, and that you can quickly find that if an individual might pose risk to a child that you previously didn't know, such as some criminal history, that you'll have that available to you. We obviously need to work hand in hand with law enforcement to make sure we're interpreting that data correctly, and then as we implement this system, it's very important that everyone understand that data is going to be very powerful, and with that power could become potential for misuse of the data. So we are at this time developing procedures and protocols as to when and how that data can be accessed. The other thing I will point out that every transaction in the system will be recorded and potentially selected for a follow-up monitoring to ensure that search of that data was appropriate and called for. That's a very brief overview of those 5 goals that we've spelled out in the program improvement plan. One of the key areas that everyone wants to know is how is this going to be measured? And that's what I'm going to try and give you a little bit of information about. We talked earlier about the 105 cases in 10 counties. We are proposing, and the Children's Bureau is in agreement, that the more data we can collect is a better reflection of the actual functioning of our system. So we're actually doubling that number for the next actually indefinite period of time, up to 213 cases. So again, thank you 10 counties who are going to continue sampling in accordance with the prior history. The state has also increased a few staff, and that we will randomly select cases from across North Carolina. Some of you have actually received your initial notice that a case has been selected for that random sample. Understand that might have caused some confusion out there because we didn't have a chance to get this webinar out, but we were also wanting to make sure that we did not delay those activities because, again, collecting that information and reviewing those cases in accordance with the plan needed to begin. So if you receive a notification that you have been selected for a case, please try to understand it's in this context. We hope that that review of the case, and maybe more than one, but even if it's a single case, will provide you with key information to understand what is going on with your county. The Children's Bureau believes, and we have agreed, that the sample being random then would imply that the same activities or outcomes are very likely to be across the state. So bringing you the data, whether or not you had a specific case in a sample at a given period of time, is one of the key ways we're going to measure that. And the Children's Bureau feels the same way, that they treat North Carolina as a state system, not a collection of 100 county systems. And for that reason, we will be sharing that data as quickly as we possibly can. It's a pretty big significant paradigm shift from what we had before, where a county experienced a number of cases at a set period of time, and you would often refer to it as the county CFSR. That won't be happening in the future. Instead, you will be, again, having cases selected. There may be one in a quarter. You may not see one for some period of time. That's just an anomaly of having an actual random sample of cases. So the system is going to look a little different. We hope that we can clarify for everyone how program monitoring and the other technical assistance that we can provide will help you think about the results of your on-site review case if you were selected for one. And I would urge you just to ask questions as you get those, because we certainly want it to make sense for everyone. And again, the point there is to make sure you have proper notice that your case has been selected for a review. There's nothing here that we're trying to catch you off guard. We want a true picture of what is happening in experiences with children and families. So that's why we wanted to give you some notice that a case was selected from your county.
So Kevin, this is Laura. So just one quick question about measurement we have from Scotland County, which is about training for the CFSR tool and if there will be more coming up for the OSRI.
Great Great question. Thank you, Scotland County. What I will tell you is that we're kind of evolving through this. So for those 10 counties, they have received that quality training. A number of other counties have invited us to provide that to them. We are taking an approach that the county will reach out to us when they're ready. If you do not have that capacity, it is not a requirement at this particular point in time. We know, particularly for very small counties, that's a significant resource commitment. We will conduct the reviews, state staff will conduct the reviews, and to the extent the county has resources, we will partner with you. It really is a situation where we definitely need you to understand the results of the OSRI process, but you don't have to have the capacity to conduct one by yourself. Having said that, we welcome all invitations, and we will train as many counties as quickly as we possibly can. The Children's Bureau is pretty particular about, as you can imagine, about the execution of that tool and understanding the criteria by which, let's face it, somewhat subjective decisions are made as you walk through that 82-page instrument. So it's again, a significant investment, and for that reason we encourage counties, particularly somewhat larger counties or staff who have quality assurance, to take a look at that and to partner with us, and we will train as many counties as we have capacity and that the counties have desire.
Great, thank you for that. So we are going to pass it on now to Shelia, who's going to talk with you about what it really means for you and your agency looking at the PIP. If you have specific questions, please type them during this last part, and we will try to capture them and hopefully have some time to answer a few at the end.
Thank you, Laura. We have heard quite a bit today, and we have looked at goals, strategies, and activities. So what does this mean for you and your agency? More focus on safety, safety assessments, safety services, safety plans. More focus on ensuring practice and consistency across the state. More focus on transferring of learning activities to ensure learning from trainings can be applied to practice. The use of the OSRI will be the way to measure outcomes. We'll utilize it for practice improvements, and it will not be for punishment. And on our next slide, we're looking at focus areas. If you look at Safety 1 and Safety 2, what this means for us is that we would like to initiate reports timely and be sure that face-to-face contacts are made within established time frames. We want to address the safety concerns that brought the case to your attention, as well as any others you have identified. Be sure all safety concerns are addressed prior to case closure. That is very important that we do that. Now, on our next slide, permanency outcome number 2, we need to look at working on improvement on quality and frequency of visits with mom, dad, siblings, and with the caseworker. It's also important to preserve connections even if the primary plan is not reunification. We would like to promote, support, and maintain positive relationships. We have heard from many youth that they have expressed a desire to have more time with their siblings. So keeping sibling groups together, even if we have large sibling groups such as 5 or more, we can do things thinking outside of the box, contacting the licensing agency office for possible waiver to this rule. And looking at another focus area for well-being 1, concerted efforts to assess the needs of and provide services to foster parents and children and their parents. We would like to involve the mothers, fathers, youth, and non-custodial parents in the case planning process. In looking at the case review system, foster parents, pre-adoptive, and kinship parents, we would like to give them notice of and a right to be heard in any review or hearing. Timely notification of case planning meetings. We would like to involve the mothers, fathers, youth, and the non-custodial parents in this case planning process as well. Now, you want to know, what can I do to make a difference? And this is your opportunity. We have 10 things that you can do to make a difference. First of all, we can get familiar with our Child and Family Services Plan, and you will find here that we have a link that you can go to read that. And number 2, make sure that all staff have the required training for their roles. We can utilize the individual training assessment feature in the personalized learning portfolio section. Number 3, use the supervisor resource section of ncswlearn.org to monitor whether or not staff has attended the required training for their position. We can also add a training from your staff that you want to add your staff, additional trainings on this website as well. Number 5, and I know most of these that you're hearing, they sound a little redundant, but it's very important that you find a way to participate and buy into this process so that we can make this a smooth transition. And number 5, if you ever hear someone say in a training, we don't do things like that in our county, please respond, well, we need to start doing it. And this is a group effort, and we want to make sure that we do the best work we can do. Number 6, ensure your foster and pre-adoptive parents are getting notices of hearing. Develop checks and balances for this, if not already in place. And number 7, ensure cases are initiated within the policy time frame. Ensure all issues related to safety have been addressed prior to case closure. Ensure child or youth is part of the case planning. And the final one, number 10, ensure the parents are involved in the case planning. And I'm going to turn it over to Kristin for next steps.
Thanks, Kristin.
Great. Thank you so much, Sheila. So just a few next steps, and then we can open this up for questions for you. But in addition to what the top 10 things that you can do that Sheila mentioned, one of the things we just really like to encourage you to do is to share the CFSR, the Quick Reference Items List, as well as the draft program improvement plan with your staff, and to the extent to which you feel is appropriate with your families, to help orient them, to get them familiar with how our performance is being rated and how that impacts the delivery of services and the work that we're doing with and for families. I know at the state level, one of the things that we have, at least I have learned, is that the more that I can get familiar with that quick reference items list, that document in and of itself has been such a great resource for, again, wrapping our minds around the complexity of some of this stuff. And then when you put that in relation to the actual program improvement plan, and to present it in a way that can help folks begin to understand this work, I think the better off that we'll be. Because coming into this and hearing it for the first time, it's overwhelming, and we can begin to break down that overwhelm into very small, manageable steps. And some of that just starts with orienting them to some basic documents. And then again, the extent to which you feel that this is appropriate, understanding that you may not have a case poll, but in the event that you do, you can also begin being proactive in helping some of your families know that they might be interviewed as a part of a case review process. If you are engaging your families in some of this education around this process, then perhaps an opportunity would present itself for you to talk a little bit about the fact that interviews are a required component of a case review process using that on-site review instrument. And then the next thing and the last thing is that starting on Thursday, this Thursday, June 23rd, this webinar, the recording of this webinar is going to be available to you. And you can see here the link for which you can get that recorded webinar. And we really do encourage you to share this with as many people in your community and your stakeholders as possible. Encourage them to watch and listen to the recording, and then to jot down questions and to continue engaging with us in the conversation. So at this point, I am going to turn this back over to Laura now to help facilitate some questions for our remaining 10 minutes or so together.
All right, thank you, Kristin. So we have a couple questions already that have come up in the chat pod. So the first one is about, will cases be pulled randomly for the other counties? Will they be from foster care and in-home plus CPS assessment, and will it be within a specific time frame? So Kevin's going to answer that one. Sorry.
Hey, Kathy. Yeah, that's a really good question. And the protocol calls that cases both in foster care and in-home be reviewed. But tying back to the federal process, we do not look at CPS assessments by themselves. The on-site review instrument does look at the assessment once a child was found to be maltreated and then provided either in-home and or foster care services. But the assessment by itself is not part of the CFSR OSRI process.
Okay, great. And then we have a question about the GAL program and wondering if that is involved as a stakeholder. So is Kristin answer? Kristin's going to answer this.
Great. And the answer to that is yes. And so if you were to take a look at Goal 3 on page 6 of 9 of that draft program improvement plan, you can see that we're going to be engaging with the North Carolina AOC staff and other judicial partners. The guardian ad litem community is included as referenced in Strategy 1B, but also just to know that we have monthly or bi-monthly interagency meetings with our AOC partners, which includes our GAL partners as well. And so they are going to be extremely instrumental in helping us to craft and to implement these particular activities.
Great. We have a question about the time frame for when you will have additional information about the Guardianship Assistance Program.
Sure. Thank you, Mozetta. That's also a question we get fairly frequently. And what I will tell you is that we are on the cusp, and hopefully very soon, the rules regarding, the administrative rules regarding the Guardianship Assistance Program will be posted for public comment. We will work diligently to make counties aware of that in case they'd like to make comments about that. And parallel to the review process for guardianship assistance, we will be developing some policy. It's one of those situations where there won't be a great deal of policy around that. Really, it's the administrative rules that will govern primarily when guardianship assistance can be awarded, or I should say made eligible, and certainly as the months go by here, once we have those rules reviewed and the Rules Review Commission approves them, then we will certainly blast that across the state and make sure you're as ready for January 1st if we're able to make that date as possible. Again, as Kristin noted, this is a cost-neutral approach, so it would, the eligibility criteria is fairly narrow. Older children who are placed with a relative and that relative is licensed, the permanency of adoption has been ruled out, or some of the key components of that.
That one. Okay, great. We have one follow-up question about the Guardianship Assistance Program, just wanting to know if it will apply to in-home services.
No, this is Kevin. No, it would only apply to children who are served by the foster care program, and again, who all other permanency options, such as reunification and adoption, have been ruled out. The data indicates that there's just less than 200 children at a given point in time where this would be applicable to. So it would not be for in-home cases. It would only be for children who are currently served by the foster care program.
Great. All right. So we have a question about time frames. So what Q1, Q2 means on the PIP. So when does that start? So Kristin's going to take this one.
Great. That Q1 or Q2 reference, those quarters are from the date in which the program improvement plan is officially accepted and effective. And so we do not yet have that date. And as soon as we do, then we will certainly begin the time frames from that point forward. So we unfortunately can't give any more clarity on that question at this particular time. We do anticipate probably maybe another month or two before that program improvement plan is probably going to be fully approved.
All right. We have a question about where the funding is going to come from for the guardianship program. and Kevin's going to take that one.
Thanks, Renee. The funding will come from the foster care budget. So the idea here is, and where it becomes cost neutral, is that these are children for whom a foster care board payment, standard board rate, is already being paid. There will be a very small savings because counties will no longer be required, if made eligible, to enact the foster care oversight administrative functions of that. So in some ways it's kind of a hybrid between how foster care board payments are made today, but it'll also look more in some ways programmatically like an adoption assistance case, meaning that you probably have had some guardianship awards today where the court case closes out and that you're no longer involved because that's determined to be a permanency measure. But in these cases, a monthly board payment will continue to be made up until the child reaches his or her 18th birthday. So the board payment or the guardianship assistance payment will mirror exactly as the foster care board payment is being made today.
All right, we have a follow-up question about guardianship. So will the guardianship requirements be the same as foster care requirements for licensing? And that's for you, Kevin, I believe.
No, there won't be ongoing licensure requirements unless that relative chooses to do that, and that would be great if they would continue to be receptive to more children being placed in their home. But if the children for whom placed were there are awarded guardianship, then the family would not be required to have ongoing licensure. That's where it also looks more like adoption assistance. If you think about it in that regard, we don't continue to oversee families and children who have been awarded adoption, and adoption assistance is being paid on their behalf.
All right. We have a question about if we foresee more children coming into foster care to access guardianship assistance.
This is Kevin. No, we do not envision more children being brought into the foster care system. These are for children who are in the foster care system and for whom the other permanency more desirable options, such as reunification, adoption, have already been explored and determined not to be appropriate. And no, it will not be retroactive. The rules are written such that it will, for children for whom guardianship is awarded on or after, and again, the goal date is January 1st, 2017.
Okay, I see. So you answered the first and the last question about guardianship. Did we get that middle one about will it be issued through the state, tracked and dispersed within the county?
Good. Thank you, Laura, for that clarification. It will be issued by the county, and then claims will be made to the state for the state share. So just like foster care board payments are made today, and 4E is eligible for guardianship assistance. That's one of the other activities that we will have to undertake, is to modify the state 4E plan. So after federal funds, it will be 50 state, 50 county % share.
Also, let me just say that one of our scheduled future webinars is going to be specifically on the guardianship assistance program. So I can see we have a lot of questions here about that specific topic, and many of those will be covered in that upcoming webinar. So let's see if we have anything else here. John's been typing a few. Kevin, do you want to take that last one about, it says, are you saying this would be applicable to children in foster care placed in licensed foster homes where they're having a board rate paid out? What about foster kids that are not in licensed homes and therefore there's no rate being paid?
Correct. Thank you, Walter. It is currently designed so it's only for children placed in relatives' homes who are also licensed. So today, that unlicensed relatives, and the vast majority of our relatives who are caring for children, are not licensed. No foster care board payment is being paid on their behalf today, and that's where we have to go with the General Assembly's request that it be a requirement that it be cost neutral. That would not be cost neutral. That would be a new payment that was being made. So it's only for licensed families, again, who have ruled out adoption.
Okay, we just have a few more minutes. We did have a question earlier about whether or not you'd have access to a copy of the slides, and I believe we will be sending you a link to that as well as the link to the recorded webinar. So just want to make sure that everyone got that information before we closed out. Let's just see if we have any last questions before we wrap things up today. So we have one more question about guardianship. Families licensed through the Caring for Our Own Kinship licensing program through CHS would qualify. That is a question. Will they qualify?
This is Kevin. To be quite honest with you, we want to take a very careful look at that. If they are licensed and a board payment is being made today, then my understanding is that they would be eligible for guardianship assistance, again, if adoption had been determined not appropriate for that child. I think the key that will help everyone understand is that the permission that we have from the General Assembly is to use our foster care budget for this guardianship assistance, providing we do so in a manner that is cost neutral. So we're really looking at taking children who are permanent or believed to be stable in a relative's home, but the relative has said it's just not culturally appropriate for me to adopt, for example, my grandchild, but I will remain committed to him or her for his or her until he reaches adulthood and probably beyond. So these are cases that you probably aren't spending a lot of administrative time on, I would imagine, but we do want to relieve that small amount of administrative burden and, again, help children achieve legal permanency where they're in very stable and very committed homes of relatives who are licensed.
All right, thank you so much. So just a few things before we end today. We have contact information on the screen for our three presenters so that you can get in touch with them if you have further things you want to ask about.